Hi, everybody. This is David Nevins for City Biz, and our guest today is Dave Krajewski, and he is the CFO of LifeBridge Health System. David, welcome to our program.
Thank you, David.
So, Dave, for the benefit of our viewers, who are many thousands, and many of whom are in Maryland, but not all. Talk a little bit about LifeBridge Health System and what its components are. You know, I think in Baltimore anyway, people are familiar with Hopkins and familiar with the University of Maryland, but you guys are right up there as a pretty significant major health system yourself. So here's your opportunity to let us know about LifeBridge Health System.
Sure. Thank you, David. LifeBridge is one of the most and possibly the most comprehensive health system, not from a size standpoint, but from a breadth of services that we provide. Currently, on an annual basis, we're providing close to or right around 2 million patient encounters throughout the state of Maryland. And we've got our 5 hospitals. Our signature, our mothership is Sinai Hospital. We've got Northwest Hospital, Carroll Hospital, Grace Medical Center, which previously was Bon Secours. And we've got Levendale, naturally, which is a nursing home. And in other states, it's called an LTAC, a long-term acute care facility. In addition to those big 5 hubs, we also have a very comprehensive network. We have one of the largest urgent care chains called Express Care in the state of Maryland, with 30 sites. We have the most comprehensive post-acute network for a hospital system in the state of Maryland, comprised of 6 hospitals that we either own or have partnerships with. One of the largest home care companies that provides skilled home care, rehab, and nursing. We also have one of the largest nationally private duty companies which provides non-skilled care aides that go and help out in the home. We have a large DME presence, durable medical equipment, a lot of home infusion that we do. We've got 2 large retail pharmacies, 6 outpatient imaging centers, 20 physical rehab centers throughout the state of Maryland. We have a very large senior living facility called Springwell, which is comprised of assisted living as well as independent living and memory care. We have hospice. We even have a fitness center. So we've pretty much touched upon every aspect, including we have some insurance products that we participate in as well from a financial investment standpoint. So it's a very comprehensive network that we're very proud of.
As you should be, Dave. I won't test our viewers on all the numbers you just gave out, but talk for a minute, because I know you guys are really proud of the significant role that you play in Maryland. Just talk for a minute about what sets LifeBridge apart in terms of, you know, the healthcare scene throughout the state.
I think there's a lot of things, but I'll start with what I left out in my introduction to LifeBridge, which is the community stuff that we do. So we currently, as part of LifeBridge, have the Center for Hope. So we're dealing with those domestic issues with violence, child abuse, and so forth, and trying to prevent them, treat them, and counsel them after they occur. So from that standpoint, we're very involved in that. We're also involved in crime prevention throughout the state of Maryland. And we're very much working with the local governments to try and preserve the neighborhoods within Baltimore City. And when we invested in Grace Medical Center, that was exactly what we were doing there. We wanted to keep a presence in West Baltimore, not only from a medical standpoint, but also putting in there a community center, which will provide opportunities for entrepreneurs, as well as things like after-school care and so forth for the residents there. So what we do with our communities, we're very proud of, and we think that sets us apart from others. But I'd say that the one thing that we do a little differently than most health systems is we're a collaborator. So one of our divisions is called LifeBridge Partners, and we believe that we can do more through partnerships than directly competing with folks. So we will partner with insurance companies. We'll partner with local businesses. We'll partner with nursing home chains like Future Care. Very few of the other systems do that to any extent, but we don't believe we have to fully control everything we do. We believe that we can find the right entities and partner with those entities and provide better services with a comprehensive approach involving partnerships.
I know that I've spoken to a number of your colleagues, and I think you used the term community health and being a big part of the community, and it strikes me that this is maybe the future of healthcare in terms of hospitals do a great job of treating people after they're sick or after they're injured and trying to make them healthy again. But I think LifeBridge puts emphasis on keeping people healthy and out of the hospital. If that's so, could you talk about that a bit?
Yeah, and I think even before you get to preventing the healthcare, some of it becomes really securing the neighborhoods, job security, housing, and so forth. So we have something called the West Baltimore Renaissance Foundation. And last year, we provided 51 grants for about $5 million in key areas like youth mentoring, workforce development, food access, and then basic population health initiatives as well. When you're dealing with areas like West Baltimore, the first thing that many of the residents are thinking about isn't healthcare at all. It's about, getting their kids in school, keeping them out of gangs, keeping them away from violence, keeping them away from drugs. So we very much invest in that aspect of the communities as well, because that's what those individuals are thinking about. But outside, we have a lot of outreach activities to try and keep chronic illness from getting into our emergency departments, keeping the individuals healthy so they don't have those acute illnesses. So we do that as well.
So, and you do it quite well, I might add. It might come as a surprise to a number of our viewers that you are in the midst of your 25th anniversary as LifeBridge Health System. And you might want to talk about that because, just to be clear, Sinai Hospital and most of your hospitals are way older than 25 years, but LifeBridge as the health system is 25 years. So I'll let you talk about that.
Yeah, Sinai is over 100 years old. Northwest is over 60 years old. So, yeah, I mean, our legacy systems are much older than 25 years. But it's a big deal to us. And we thought long and hard about how to celebrate our 25th anniversary. And we decided that rather than, throwing a bunch of money at some kind of elaborate event or anything else, that we would do what is at our core, which is reaching out to our communities and celebrating our 25th anniversary by reaching out to our communities. So we've launched a bunch of different volunteering type efforts. And we've done things from groundskeeping at schools to packing food at rescue missions, back to school supplies drives we've done, serving meals at local shelters. We have a Thanksgiving food drive that we're finishing up with the Ed Reed Foundation. And we're going to continue through this year doing community outreach as a way of celebrating our 25th anniversary rather than a glitzy event or something like that. So that's what our core belief is, that that's the best way of celebrating our 25th anniversary.
And I think that makes sense. I know you all take seriously your role of essentially improving the healthcare of the communities you serve. And some of the examples you just gave, David, and others, I know have been really at the heart of what LifeBridge is all about. Before we go, let me let you talk a little bit about yourself and your years with LifeBridge Health System. How did you get to LifeBridge, and what's your background, David?
Okay. I'm a local Dundalk kid, so I've been a resident of Maryland my entire life and lived in the Dundalk area until I was 35. I went to work for Arthur Anderson and then was lucky enough to get the controller's job at Baltimore County General Hospital. and then ultimately was promoted to CFO of Baltimore County, or Northwest Hospital. Baltimore County was renamed. And then my first 12 or 13 years of LifeBridge, I was the #2 financial officer. And about 11, 12 years ago, I was promoted to the CFO of the system. And along the way, I was also given the privilege of running the LifeBridge Partners division. So I'm the president of LifeBridge Partners as well, which is most of our non-hospital type services, urgent care, nursing homes, and so forth. It's been a great ride. I love it here, and I intend on retiring here and creating a legacy here for LifeBridge. So I love it here. But more importantly, I'd like to talk a little bit about LifeBridge's future if we have the time.
Please do. Yes, I was just going to ask you before we parted to do that.
Oh, okay. I'm sorry, David. I'm looking forward to taking LifeBridge and helping take LifeBridge to be one of the most consumer-centric healthcare organizations anywhere. Right now, getting through the healthcare system anywhere in the country is a maze. And it's very intimidating for folks when they're ill and their families to figure out how to access all the different services that they may need when an episode of acute illness occurs. Our concept is we want to break down that maze, and we want to make it seamless and easy for the consumers to access the care they need in the right places they need and in the right ways they need it. So we are really working hard right now at creating an approach where patients don't have to worry about setting up their physical therapy visits or getting their pharmacy order delivered, or their walkers or their durable medical equipment, or their physician follow-up visits. We want to create a platform where that's all there for them if they so choose to have it done for them. And they'll always have their ability to choose wherever they want to go, but we want to create it so that when they're leaving the hospital or before they even come to the hospital, all those barriers to getting access are broken down. And part of that is us also looking into the insurance side of things so that the patients don't have to deal with pre-authorizations and that type of thing. So we're going to work real hard over the next 5 to 10 years to create that consumer-oriented approach to providing healthcare. We're always going to try to provide, and we always will provide, the highest quality of services. But it's our belief that we've got to take the friction out of the healthcare system and make it easier for individuals to access in an affordable way.
Well, it sounds like you just gave another example of how LifeBridge takes so seriously the healthcare of the communities you serve, and I think our viewers can really appreciate that, and that really becomes the hallmark of the celebration of your 25th. Galas can come and go, but taking care of the healthcare of the communities you serve will be your reputation for a long time. And David, whether it takes 5 more years, as you said, or possibly 10 to execute the program that you're talking about, hopefully you and I can come back, and hopefully we're both still around doing what we're doing to give an update on that. Anything else you wanted to add? Otherwise, I just wanted to thank you for your time and congratulate you and your colleagues at LifeBridge for 25 years of great service to Maryland.
Well, thank you very much for this opportunity. I appreciate that.
It's our pleasure. This is David Nevins for City Biz. Thank you so much for joining us today.